Hi everyone, and thank you for joining us this evening for this hour of CF Live. So you'll be hearing about support available for students in further and higher education who are living with CF. This will include an outline of the options and support available from education providers, social workers, and the Cystic Fibrosis Trust. So my name is Vicky. I'm a welfare officer at the Trust, working within the support service team. As part of my role, I provide the student support service, which you will hear more about later. We are lucky enough tonight to be joined this evening by Sangeeta, our welfare and rights advisor, Rebecca, a cystic fibrosis social worker, Samir, a student in their final year at uni, and Serena, a parent to a student in their first year at uni. If anyone has any questions at all, please do add it to the chat. We'll try and respond. If not during the session, we'll provide responses where relevant in the coming days. So to kick us off tonight, it's over to Sangeeta to talk about her role at the Trust, disabilities and benefits.
Hi everyone, thank you for joining us tonight. As you know, my name is Sangeeta. I may have worked with some of you before, so hello if I know you, and hello if I don't know you. I want to quickly outline for you just where I fit within the Cystic Fibrosis Trust and what support I can provide for you. I work within the support service, and the support service provides generally a few different services. Next slide, please, Danny. So an overview of my support is listed on the slide. However, just to let you know that we also have a helpline, in case you didn't know. We also provide peer support for parents, which is called our CF Connect service. We also have a grants program, and we also have an income maximisation service and a student support service, which both are run by Nikki, who you've just met. The service that I provide generally concentrates on support for people with welfare benefits. So I give advice on applications, decisions on benefits such as personal independence payment, disability living allowance, universal credit, and carers allowance. And those are just some examples. There are loads of benefits, obviously. And I can check entitlement, can give advice on changes of circumstances. So if you're about to have or thinking of considering a change of circumstances, then clearly you might want to speak to me about what impact that will have on your benefits entitlement. I also deal with appeals. So unfortunately, I'm very busy with appeals, both the personal independence payment, sometimes disability living allowance as well. So I do casework, sometimes representation, and also help people to gather good medical evidence. Another part of my role is to give advice and advocacy on issues such as employment rights, housing rights, where I would normally signpost to other sources of advice and support, like specialist solicitors or legal advice. And that's because I'm not a specialist, but I do have general knowledge on things like disability discrimination, and I can help you identify whether that's something that may have happened to you and how to take legal advice, how to pursue a remedy, and what the deadlines are. Just quickly, 3 other things that are part of my role. I also support cystic fibrosis social workers to assist their patients with benefit inquiries. I also provide training and support for CF teams, which will include nurses, social workers, all sorts of health professionals. And also really, it's sort of important part of my role is working with our policy team. And that is so that we can use your experiences to influence making the world a better place for all people with cystic fibrosis in terms of public policy. I'm going to talk about the word disability. I think really we just have to put it out there because the words disabled and disability often spark a lot of discussion amongst the cystic fibrosis community. Some people might feel that these are not words we should use when describing CF. So why do we sometimes describe cystic fibrosis as a disability? We are absolutely committed to uniting for a life unlimited by cystic fibrosis. We want to see a day where CF doesn't limit the lives to those born with the condition in any way. We also know that many of those who have CF don't want to be defined by it either, and can see labels such as disabled as negative and not applicable to the way that they live their lives. However, there are times when a lifelong condition like cystic fibrosis, which brings a burden of treatment, times of ill health, and the need for regular specialist hospital care can bring challenges. And this is when your legal rights are important in many aspects of life, including work and in education. So the word disability, what does it really mean? What is it anyway? And obviously, I'm here to talk to you about your legal rights. If you're treated unfairly because of a disability or another characteristic such as race, age, or gender, which are protected characteristics, this is discrimination. In England, Wales, and Scotland, the Equality Act 2010 is the key piece of legislation to protect you against discrimination. And in Northern Ireland, the legislation is called the Disability Discrimination Act 1995. Under both of these acts, you are defined as having a disability if you have a physical or mental impairment that has a substantial and long-term negative effect on your ability to do normal daily activities. We would argue that for most people who have CF, the effects of the condition are both substantial and long-term, although you may or may not feel this applies to you. Under the DDA in Northern Ireland, people with progressive conditions like cystic fibrosis are protected, even if the impact on day-to-day activities is slight rather than substantial. When we use the word disability in relation to cystic fibrosis, we are often doing so because we are talking about someone's legal rights and because we want to ensure that people with cystic fibrosis are protected from discrimination in their everyday activities. I want to talk a little bit about reasonable adjustments. One of the key themes under both of those acts is the duty to make reasonable adjustments for people with disabilities. This can be really important for people with cystic fibrosis. For example, in the workplace, a reasonable adjustment could mean an employer allowing flexible working hours to give time for treatments before or after work. The duty to consider reasonable adjustments under both acts runs across the whole range of day-to-day activities, not just work, and helps to ensure that people with disabilities are protected against discrimination. So have a think, what barriers do you have to you studying successfully? What support do you need from the institution, either your college or your university, to achieve your studies? What adjustments could help you? So for example, timetable planning to avoid fatigue and maybe problem environments. A conversation that you can have with Nikki or your social worker and your education providers, Students' Union Advisor and Support Services. I'm sure that they'd be willing to discuss it with you, but don't forget to ask about reasonable adjustments. Some of you may have already heard about personal independence payment. I spend about 90% of my workload dealing with personal independence payment, whether it's a claim, a reconsideration, or an appeal. And some of you, when you turn 16, if you're on the call, I may have helped your parents when it came from you transferring from disability living allowance to personal independence payment. So if you're not already getting personal independence payment, which we'll call PIP, do you meet the criteria for claiming this financial support because of your CF? So I want to tell you quickly about John, obviously not his real name, who's a student at university, who told me specifically that getting PIP helped him to afford the higher costs of high calorie foods, to afford the higher rent so that he could be in a dirt and mold-free environment with lectures and facilities closer by. And he also told me that it helped him to afford transport between home and back, and to cover, in general, the income I cannot earn through part-time work due to the time and energy taken up by my treatments and university itself. He said most students can cope with part-time work to supplement their loans. So how much is PIP? Obviously, I put the details on that slide there. So some people get the standard rate daily living, which is £60 a week, and some people get the enhanced rate daily living, which is £89.60 a week. Some people qualify for the mobility part in addition, and the standard rate of that is £23.70 a week, and some people qualify for the enhanced rate mobility, which is £62.55. Each rate has got there are specific points that you need to get under a list of descriptors in order to tell you which one you'll qualify for. And finally, from me, I want to talk about universal credit. So universal credit is something that generally students are not eligible to claim. However, there are some exceptions. For example, certain students with children can claim universal credit, and also more relevant for obviously us today is students who have an illness or a disability. However, only if they have limited capability for work, more on that in a moment, and also get PIP, for example, or other disability benefits. So the idea of having limited capability for work, it's not just a concept, it's some words that mean that the Department of Work and Pensions have made a decision and accepted that you have limited capability for work. The problem for these students is that they need to have been found to have limited capability for work by the Department for Work and Pensions, and these are the two important parts: on or before the date of claim to universal credit, and also before they start the course. To try and get around this issue, students who need universal credit could first make a claim for a benefit called New Style Employment and Support Allowance. So I know we're getting really technical here. They won't usually be eligible for that benefit, and I won't go into all of that now, but a claim for New Style ESA means that that could trigger what's called a work capability assessment. And a work capability assessment is the process by which the Department of Work and Pensions decides whether you have limited capability for work. So once you've had a work capability assessment to see whether you're eligible for the national insurance credits that come with that benefit, and you're found to have limited capability for work, then you can claim universal credit. And all this needs to happen before you start your course, which could be further or higher education. I accept that's hugely technical, hugely complex. It's something that Nikki and I, sometimes struggle to explain and get our heads around, and it's been a big changing area of law over the last couple of years. But that's what we're here for. We're here to guide you through it. And also, I would say that there are no hard and fast rules when it comes to telling you that you're eligible for a benefit, because it will all depend on your circumstances. So for example, if you have savings or you're in a couple, all of those things will be relevant too. So I would say that these are general principles about studying and universal credit, and whether or not you're entitled, you should always seek specialist advice. And that's what I'm here for. It's a highly individualized situation. So now I'm going to pass on to Nikki, who's developed a service supporting students to claim benefits. And just before she comes on, I wanted to tell you that we work together. So if you were going to claim universal credit, then I'd be able to support students with the limited capability for work questionnaires, checking that you meet the criteria for benefits. And then Nikki can also look at how universal credit is affected by your student finance, any other income you have from a part-time job, for example, and any loans. We work really closely together and we do slightly different things. But hopefully, if you come to one of us, you'll get help from both of us. Thank you. Thank you for listening.
Thank you, Sangeeta. Some really useful information there. Bear with me while I try and figure out how to share my slides. So give me 2 seconds. And if I was going to present this as a slideshow, I would press that button. Ta-da! Okay, so bear with while I... Cool, awesome. So a fair bit to get through. So I'm just going to jump straight in. So let's start by looking at further education. So this includes any study after secondary education that is not part of higher education. So that is not taken as part of an undergrad or a graduate degree. Sorry, so many tabs on my screen. There we go. So for students aged 16 to 19, in England, there's the 16 to 19 bursary fund. This is up to £1,200 a year, depending on your circumstances and benefits, available if you get personal independence payments in your name and either ESA or universal credit. As a bursary, it does not have to be repaid. In Scotland, Wales and Northern Ireland, there is the Education Maintenance Allowance, or EMA, which is means tested weekly allowance for 16 to 19-year-olds. It's paid fortnightly in arrears, only during term time. It's not paid during breaks. The amount for this is means tested against the household income, but if received, it does not affect other household benefits. And the discretionary support in England, or the Financial Contingency Fund in Wales, which is support for learners who are aged 16 or over and on a full-time course provided by, and this fund is provided by the education provider at their discretion. For students 19 or over, there's the Advanced Learner Loans in England. These are available to all learners aged 19 and over for qualifications at an approved college or training provider. So this covers the cost of tuition and is repayable when you start earning over the magic number, £27,295 a year. You repay at 9% of your income above this level. It is worth noting though, if you're studying at a level 3 qualification, you might be eligible for the Adult Education Budget Grant instead of the Advanced Learner Loan. And if you get the grant, you don't need to repay it. So before you apply for the loan, it's good to speak to your college or training provider to see if you're eligible for the grant instead. There's the Welsh Government Learning Grant. This is income assessed and provides funding to help you with the cost of education if you're age 19 or over. If you're studying full-time, you can get a payment of up to £1,500 a year. And if you're studying part-time, you can get up to £750 a year. This does not need to be repaid. The Further Education Grant in Northern Ireland may be available to help you pay fees and need help with this. You can also apply for the grant to help towards living costs, and it does not need to be repaid. And finally, the Bursary Maintenance Allowance in Scotland is another income assessed allowance. It is discretionary and it does not need to be repaid. So moving on to higher education. Higher education qualifications include diplomas, bachelor's degrees, foundation and postgrad degrees. So there's student finance, of course. This contributes to the cost of tuition and maintenance to help live while studying. It is normally means tested against the parent's income unless a student is independent. In some nations, it's repayable and only then when you start earning above the level set by government. And you pay 9% of your income above this level. You start repaying the loan from the April following graduation and when you're earning above that set amount. This set amount differs across the 4 nations. The special support element in England, or the grant in Northern Ireland, so this is available for certain students, including single parents, those in receipt of means tested welfare benefits, or those with a disability and you're in receipt of DLA or PIP. You receive the special support element or grant as part of the maintenance loan through student finance, and the special support is disregarded as income for the purposes of claiming a means tested benefit such as housing benefit or universal credit. Student finance can also cover things like dependents, including adults, childcare, parents, learning allowance, and so on. Again, these differ across the nations, so I'd always encourage anyone to get advice and check the award when it comes through, just to make sure you're getting all the elements and everything you're entitled to. The big question, we all know the answer to this, is student finance enough? So this map shows the average cost of living for students across the UK, according to a Save the Student Student Money Survey 2020. It highlights that the average cost of living as a student range from £655 a month in Northern Ireland up to up in £933 a month in England. However, the average award through student finance to help with the cost of living is around £572 a month. Most students top up their earnings through part-time work, but when living with CF, this is not always an option. I'm just gonna bear with me 1 second. So what else is there? Hardship funds and bursaries. So there's discretionary and institutional funds. These are known as hardship funds in England, discretionary funds in Scotland, financial contingency fund scheme in Wales, and the support fund in Northern Ireland. So these are given at the discretion of the education provider, as they are expected to provide funds to alleviate student hardship and to support retention and progress. There's also scholarships, bursaries and grants, which don't have to be repaid and can make a huge difference to your student budget. Surprisingly though, less than a third of freshers last year applied for a scholarship or bursary, and the most common reason was that they didn't think they were eligible for one. Of those that did apply, 75% were awarded. And extra funding is given for all sorts of reasons, not just for straight A students, so it's definitely worth exploring for sure. At the Trust, we provide the Education Grant, which is administered on behalf of the Trust by the Joseph Levy Education Fund. The fund helps adults with CF over the age of 18 with the cost of higher education or other professional qualifications, including vocational training. Family Action also offer education grants to help with the cost of studying. And of course, there's welfare benefits. As Sangeeta mentioned, generally full-time students cannot claim UC. However, if they're getting PIP and have been found to have limited capability for work before they start their course, they can apply. Do seek advice about this, as it can be confusing. And with any universal credit claim, it's always better to get advice first. And speak to your university, your student union and/or student services may offer workshops or budgeting and money management or individual support, hardship funds and whatnot. They are there to offer help, guidance and information to ensure you make the most out of your time at university. Students living with CF often combine studying with the daily fitness routines needed to stay well. So this includes, but not limited to, things like physiotherapy, physical exercise, rest, medication, and so on. Disabled Students Allowance can provide grants to buy equipment and fund non-medical helpers to help students living with CF to get the most out of student life and make things a little easier. Disabled Students Allowances cover extra disability-related costs or expenses you have while studying, which are over and above those provided as reasonable adjustments by the college or uni. So these are available across the UK. Students can apply for allowances on top of other student finance, and you do not need to repay a DSA or Disabled Students Allowance. You can also apply at any point along your journey through higher education. It is important to remember Sangeeta's point that education providers must make reasonable adjustments to avoid disabled students being placed at a substantial disadvantage. But DSA can sort of go above and beyond that. So to be eligible for a Disabled Students Allowance, your condition must meet the definition of a disability under the Equality Act 2010 or DDA, and either be studying an eligible full or part-time undergrad course, like H&C degree, or distance learning, or an eligible full or part-time postgrad course, again including distance learning. So part-time students living in England, Wales and Northern Ireland must be studying at least 25% of the length of a full-time course to qualify, while in Scotland, part-time students must be studying at least 50% of the full-time course. If you're not sure whether your course qualifies, do check with your education provider, they will know. You may still be able to get DSA if you're doing certain types of unpaid work experience in the public or voluntary sector. And even if you don't qualify for a DSA during a placement year, you may be able to get help through the Access to Work scheme or the Work Psychology, yeah, always struggle with that word, or the Work Psychology Service in Northern Ireland. The type of support you get through DSA very dependent on your individual circumstances and the course that you're studying. It doesn't matter, and they do not look at your household income. So DSAs are separated into 4 allowances, and these cover different areas of need. So the general allowance, known as basic allowance in Scotland. So that can help with things like photocopying and individual printing costs, perhaps a mini fridge for your room. The specialist equipment allowance, or large items allowance, known in Scotland, can help with things like printers, scanners, specialist furniture such as an ergonomic chair, table and back support, disability related software, laptops and PC. The non-medical helper allowance, or non-medical personal helper allowance in Scotland, can help with things like IT software, training, an electronic note taker and so on. And then finally, the travel allowance, which is not available in Scotland through DSA. However, in Scotland, you may be able to claim it through the Student Awards Agency for Scotland to help with travel. In both cases, the following apply. So as a student living with CF, you may be able to get help with the extra cost of travelling to and from lectures, including work placements, if you're unable to use public transport. Maybe because of infection, limited mobility or fatigue. It is important to consider not just your ability to travel to lectures, but also be well enough to participate and then be able to travel home again. On the Cystic Fibrosis Trust website, there are a few really useful resources. So there's a Q&A with 2 former students who were both living with CF. They answer questions on their experiences of money, budgeting, and getting support from their university. They also share their top tips, and there's one of them on screen now. The Disabled Students Allowances DSA Explained page has frequently asked questions about DSA and possible support available for students living with cystic fibrosis. And the Financial Support and Budgeting at University page contains hints, tips, and financial resources to help cover the extra costs associated with studying with a disability. The Student Support Service at the Trust, this is me. So I support students new or continuing with further or higher education to explore different financial options available to increase your income. I provide individual, personalised one-to-one support to talk through your financial circumstances, and we consider together all the options available to increase your income, such as the elements of student loans, welfare benefits with Sangeeta's help, and discretionary payments, and can look at budgeting and discounts. We also discuss your rights and support you to apply for a disabled students allowance and consider what support you may need to get the most out of your studies and enjoy student life while living with CF. To access this, just contact our helpline either via email or on the number shown here. I know that there was a lot there and I've whizzed through it fairly quickly, so if you have any questions, please do pop it in the chat or contact our helpline. I'm now going to hand over to the lovely Rebecca to discuss how she supports students in her role as a cystic fibrosis social worker. If I can figure out how I stop sharing my screen. There we go. Thank you.
Thank you very much, Nikki. Thank you. Hi, everyone. So my name is Rebecca Fallon. I'm a cystic fibrosis social worker at the Manchester Adult CF Centre. Thank you for having me here tonight. So I'm going to aim to highlight some of the areas of support that social workers might be able to help when people with CF embark on their journey as a student. Okay, so you're obviously aware that CF centres have multidisciplinary teams with many specialist staff there. Most also have a social worker or a team of social workers who are dedicated to support the people too. So the role of a CF social worker is very varied, much like the people with CF with whom we work. So social work support is tailored to each person according to their individual need. And it's this advice, it can be advice, it can be general support, it can be helping directly with tasks. And this slide just shows some of the things that we can help with. And it is deliberately laid out to reflect the juggling act of life, or perhaps the stepping stones in life, which are not necessarily in any ordered sequence, as each person is obviously very unique. And for that reason, we have a holistic approach to try and support people in relation to their CF, with any resulting needs that they might have in terms of housing, benefits, employment, education, including issues that might arise when living with CF as a student. We can be an advocate for the young person, support them with the physical and their emotional health in relation to life events such as transition, their relationships with others, any difficult family situations, as well as being mindful of safeguarding and risk assessments where needed, of course. As the CF centres are usually regional and can cover quite a vast geographical area, the cystic fibrosis social worker can liaise where appropriate with the local authorities if there's any community services that might be required at any point, as well as working closely with our CF colleagues across the other centres, and also with the CF Trust and their helpline and valuable sources of support. So as you have already heard from Sangeeta and Nikki, there is a whole host of potential options of financial support for people with CF who are students. And it obviously does range from the usual student loans administered by Student Finance England, Student Awards Agency Scotland, Student Finance Wales and Student Finance Northern Ireland, or the NHS bursaries, depending on the course. But there also are other additional financial support that is available for students with disabilities or health conditions such as CF, including the benefits mentioned by Sangeeta. So we've got the PIP, universal credit, etc. So social workers can help to support people with the benefit applications. We do have a general knowledge of the benefits. I do say though, we're by no means experts, and we are very thankful that we do have the expertise of Sangeeta and Nikki for guidance and to be able to refer people to them when the situation is perhaps a bit more complex. But generally, we do support people with completing the applications and also with going through any considerations or appeals if needed too. So Disabled Student Allowance and the NHS Disabled Student Allowance for students in receipt of the NHS bursaries is such a useful form of support. As Nikki has just mentioned, all the different ways it can be helpful to people. So we really do encourage people to apply for this. And as social workers, we can support students with their application forms, including the medical completion of the medical details that just needs to be given for evidence of the condition of CF and just proof of eligibility, basically. So they are individualised packages of support, and it's just to help you to undertake your course, really, and alleviate some of those stresses. And there's so many different uses, as Nikki highlighted. We've seen it being used for lots of different ways. One of the popular things is in terms of covering the costs for the ensuite in halls of residence, because there's additional costs obviously there, having a fridge in the bedroom for medications or for extra snacks as well, the equipment such as laptops, printers, note takers, things like that. So it is a great thing to access. Mentioned the benefits. There's also the hardship funds that universities and colleges generally have their own schemes of financial support. They're usually means tested and for their own students attending there who are facing hardship for any reason. And as social workers, we also inform students about the relevant charities or grants available, including the brilliant Joseph Levy Education Fund that's also been mentioned tonight. This has been really, really helpful for a lot of our students in Manchester. And it just provides further support for either the education or for careers. It can be vocational as well. So it's a really quite widely used fund. Students apply to them directly, but often the social workers are the ones who are directing the students to the charity or being noted as a reference to be able to support their application. And of course, there is the CF Trust grants, including the prescription prepayment certificates, health and wellbeing grants and the emergency grants, which might be appropriate in certain situations for some students whilst they're managing their CF. We're very thankful that we can also refer people into the student support service and the income maximisation service as well, run by Nikki when this is required. It's a really useful form of support. Okay, so in terms of what kind of practical and emotional support can we offer as social workers for students with CF? So they might need advice about housing, whether it's halls of residence or student accommodation, advice about having your fridge in your room for medication and snacks, advice about an ensuite for privacy. It might be that students are suffering digestive difficulties as a result of the CF. They might have medication requirements and they might have a need for frequent washing, all of which it can be really helpful to have an ensuite to have that privacy. And as I said before, some of the disabled student allowances can be used towards some such additional costs. And students with CF are also usually undertaking a transition from the children's hospitals to the adult CF centres. So they're already trying to get to know a new team, a new environment, potential new treatment regimes. And this is the time that social workers might be helpful in being a consistent and familiar person who can help support the student with CF in their transition and in their newfound independence. it's obviously a time that responsibilities start to increase. So responsibilities for treatment, starting to generally look after themselves. And so social workers can help support with things like budgeting, you know, things like having cheap but nutritious and high calorie meal ideas. We can liaise with the dietitians for things like that. So we're quite a good kind of pivotal point in the team to be able to help with things and get advice from the other professionals in terms of how to help increase your independence and take responsibilities for aspects of your CF. And within this support and encouraging the independence, there is also the recognition that this can be a really difficult time for parents and carers and other family members as well. You know, social workers can help support the discussions really about this and appreciate the change in roles within families. They can be really difficult for people. You know, family have spent the last 18 years nurturing and caring for their loved one, ensuring that all their CF needs are met. And it does take time to adapt to new roles and independence of your child, essentially. And for that child who's now an adult, meeting new people is obviously a huge part of university life, which can be really exciting, but really daunting as well for many young people. Students with CF might need some social work support or advice in helping the young person to think about having discussions with others about the CF. It can be beneficial for university tutors and lecturers to know about the CF for many reasons, but also new friends or partners to know about CF too. And this is really for support and understanding whenever this might be needed. I mean, as we're all aware, CF is a very variable condition and symptoms can really fluctuate between good days and bad days. And it can just help if those closest to the person, such as the housemates or the course friends, if they're aware of the CF, it just helps them to understand, and as well as being a protective factor for the young person, to have support around them when needed. It's also quite important as well in terms of managing risks of cross-infection. For example, if universities or colleges can be informed that a student has CF and that it's important for this person not to mix with others with CF, and the medical reasons behind this, it can just help to support the students and help ensure that their paths don't cross. Likewise, informing new friends about this helps to have peace of mind that they'll remain safe and not mixing with others with CF as well. And as social workers, we can support the student in thinking through these discussions, as well as liaising directly with universities or colleges, with the student's permission, of course, to inform them about CF, as they might not have encountered anybody with the condition before. They might just need a little bit of education about what it means. Okay, so in terms of managing time, social workers can support students with fitting in their essential daily treatment regimes within the busy student lives. It's obviously a time for studies, but also, you know, bearing in mind the importance for treatment and optimizing health, and also the time for a student's social life, and how to gain a good work, health and play balance, really. Likewise, it might be difficult for the student to undertake the studies at a particular time if they're unwell, or they're in hospital, or they've got absences from lectures due to clinic appointments and things like that. It might be that social work support is required to liaise with the university or the college and providing evidence of the condition or of appointments and confirmation of hospital admissions, that kind of thing. And also it can be really useful to request extensions to deadlines if needed under extenuating circumstances, requesting extra time in exams. And social workers can advise and support about this and arrange the medical evidence to support these requests as well. So there is some general liaison really with student support services or disability advisors as well at university or college, when the student might be encountering difficult times with the health, or even just difficult times in general. And although CF social workers, due to our connections with other professionals and services, we can be an advocate for the student for a number of issues really. And we might need to write some letters to support the student or assist in meetings between the student and lecturers, perhaps, if any such reasonable adjustments are required. You know, perhaps regarding vocational placements as well for some courses. But likewise, the social worker can be an advocate for the student with external agencies as well, such as letting agencies when moving out of halls of residence into student accommodation. And I guess also we can be their advocate within the CF medical team too, if needed. And, you know, we can help in empowering the young person to be able to have discussions with the medical team in relation to any health issues that might be impacting on their studies, or vice versa, really. I guess generally, the important message is that we're here to listen to you, to give advice, but generally help to support you through juggling the life events that will happen inevitably whilst living with CF. So thank you for listening. I wish you all the best on your new adventure. And I guess the main thing to remember is that your social worker, as part of the whole team, is there to help support you in your journey with CF and in life. And it can just help to have a friendly face along the way to bounce ideas off or ask for support. And this is what we're all here to do, to help you to be the best you and to live your best life. Thanks for listening. I think I'm handing you over now to Samir. Thank you, Samir.
Thank you, Rebecca. Good evening, everyone. I hope you're all well. So my name is Samir. I'm 20 years old, living with CF, and I'm a third-year student at UCL studying biochemical engineering. So there's two things I want to talk about today. The first is how to apply for DSA based on my own personal experience. And then I'll also be talking about the support that universities can offer for people with any medical condition in general. So for those of you who are looking to apply for DSA, you might be worried about how to start, how the process will be. I'm sure many members of the audience will be familiar with PIP. I've had to apply for PIP twice, and the process itself caused me a lot of stress and worry. But I have to say, applying for DSA is so much more easier than applying for PIP. And when I was applying for DSA, this was during the heights of the pandemic, and yet it was just a much easier process. So what I have here on this slide is the milestones in your DSA journey, and this will be applicable to every person that applies for DSA. So the first thing to do is to fill out the application form. The form is very simple to fill out. It's basically a questionnaire asking you very basic yes or no questions and some personal details. You don't need to talk about your medical condition at all. You just need to state what it is. Just a point I need to address is that there's a section in the form that asks for a customer reference number. And what this is, for people that have a student finance account, that account has a customer reference number. So if you're currently receiving student finance, you just need to write that number in. If you don't have student finance, just leave it completely blank. And then after you fill out the form, you need to send that off along with some medical evidence. The medical evidence can be very simple. Just ask your nurse or doctor for a letter that confirms you have the medical condition you have. As a very short one-page letter is adequate. You don't need to send them any accompanying medical records or prescription letters. So now that you have your completed form and the letter of evidence, send the two documents through the post and just wait for a response. And so remember earlier when I said if you don't have student finance, leave the part where it asks for a customer reference number blank. For those of you that will be doing that, you will receive a letter through the post from student finance that says, thank you for applying for student finance. We have set up a student finance account for you, and you will get a signing details for that in a separate letter. And so at that point, you might be thinking, well, hang on a minute, did I apply for DSA or student finance? And that letter is absolutely nothing to be alarmed about. Basically, when you're applying for DSA, they need to assign you with a customer reference number that links to your DSA application. And you'll see this going forward. Every letter you receive from the DSA team, it will have your customer reference number. Whenever you need to send an email to the DSA team, you have to include your customer reference number. So remember that student finance or the organization that provides the DSA service, the two aren't separate entities. So for those of you that filled out the customer reference number in the DSA form, you won't get the letter. For those of you who didn't, you will receive the letter. And on a separate letter, you'll get the login details for your newly made student finance account. This account you don't have to do anything with. I'll say just try logging into it once to make sure the login details they provided work. And after that, you never have to touch that account again. And in case you're worried that now that you have a student finance account, they might start loaning you money which you didn't ask for, or it's now an obligation for you to ask for a loan. Nothing like that will ever happen. And so after a few weeks, you'll receive an email from the DSA team saying, we have reviewed your application and can confirm that you are eligible for DSA. So as long as you fill out the form in its entirety and provide the medical evidence, then you should receive eligibility. The email will contain a PDF attachment, which is a letter that reiterates what was said in the email, that you are eligible for DSA. So now that you have this letter, you can now move on into the next stage of finding out what DSA support you will need and if it will be approved. And in this letter, there will be a link to the website. So you click the link and it will show you a list of all the assessment centers. Enter your postcode to find the closest one. And then you select the assessment center you want to go for. It will provide you with the contact details. And you just contact them, tell them you have been made eligible for DSA and would like to book a study news appointment. Now, depending on the center, they might want to have their appointment in person, but if you prefer to have it over the phone or a video call, just tell them you prefer this and they should be able to arrange that. And then after you book the appointment, the person you will be having your appointment with, who's called the needs assessor, will send you an email confirming the appointment details. And in the email, the assessor will ask you for 3 documents. He or she will ask you for your DSA eligibility letter, the same medical evidence you sent with your DSA application form. So make sure to have another copy of that letter. And then the third document is a pre-assessment form. So this is a form that you'll get in the email that the needs assessor will send you. And it's very straightforward to fill out. It's only 2 pages long. They ask you for some personal details and they will ask you a few questions about what the difficulties your disability causes. And when you answer this, just give a few bullet point answers. Don't worry about going into detail. All you're trying to do is give the assessor a rough image of your situation, so he or she has some understanding going into their appointment. So you return that form along with the other 2 documents by email, then attend your appointment, meet the assessor you've been speaking to through email, and in the appointment, the assessor will start by asking you some questions about the problems associated with your disability before moving on into asking about how it affects your studies. And they won't expect you to come to them with solutions to these problems. That's their job. All you do is describe your condition and difficulties to the best of your ability. To give some examples from my experience, I mentioned that I struggle to pay attention to lectures due to fatigue, which is caused by my condition. And this results in me going home, watching the lecture, recording back in its entirety, and spend so much time just pausing the recording to take notes. And then what my sister recommended is that there's a software called Sonicant. Basically, when you're at your lecture, you'll have the lecture slides on your laptop, and then the mic on the laptop will be switched on. The mic records what the lecturer is saying and assigns the audio recording to the correct slides. And then you can highlight key parts of the audio. And so then after the lecture, you can listen back to the key parts of the audio recording that you highlighted and make notes on those parts rather than rewatching the whole 2-hour lecture recording again. And then I also have to do a lot of reading, which I find very energy sapping. The suggestion made here was a multifunction scanner that can scan documents into a laptop and convert the text into audio. So these are just some examples of technology that I would never have thought of. And you'd also receive training on how to use these technologies. And the assessment, it's not like an interview where you're going to be judged. It's the complete polar opposite. It's like having a conversation with your doctor at a clinic appointment. Like the person I spoke to was one of the nicest people I've ever met in terms of how good the rapport, the way he spoke, his mannerisms. Within 30 seconds of the appointment, any worry and nervousness I had going into it was completely gone. And yeah, these people are highly skilled and trained at performing these assessments and making it comfortable for the person. And yeah, so after the assessment, the assessor will spend the next few days writing up a report that documents all the problems you discussed and the equipment he or she recommends to address these problems. And it will also contain a few technology supplier options to provide the recommended equipment, as well as some supplier options to provide the technology training. And you'll receive a copy of this report, give your consent and approval that you're happy to submit it. And then the report is sent to the DSA team, they will review it. And then after a few weeks, you'll receive a decision by email. This email will contain a letter, and hopefully the letter will say that you have been approved for DSA. And if that's the case, the letter will provide a breakdown of how much money you have to contribute to receive the equipment and how much student finance will cover. And student finance will typically cover the majority of the costs. And depending on your case, you may not have to contribute anything to the funding at all. So the letter will also contain the contact details of the suppliers that you need to contact to receive the equipment and technology training from. They would have picked these suppliers from the options that your assessor provided them in the report. And then from that point on, just contact your supplier, show them your approval letter, and they will be in charge of supplying and delivering all of your equipment that you have been approved for. And yet, to summarize, the milestones in your DSA application journey is filling out the DSA form, receive eligibility, have an appointment with the needs assessor, and then you'll receive a decision. And then a successful decision will lead to you contacting the supplier to receive your equipment. So I'll now talk a bit about the support I received from my uni, which may be applicable to the unis you might be applying for, or you might be going to. So here at UCL, they offer something called a SORA, which stands for a summary of reasonable adjustments. So how it works is that you book an appointment with one of their health and wellbeing officers, and you tell this person about your health condition and the difficulties you experience. And just like in the DSA appointment, this person will offer some adjustments that can cater for these difficulties within the confines of the uni. So a list of these adjustments will be written on a document called a SORA, which the uni will look at and approve. And then you are now free to exercise those adjustments without having to provide any rationale. So for example, I can request for a 1-week deadline extension on any coursework. I can also receive extra time during exams. During lectures, I'm allowed to leave the lecture room to have a break without having to ask for permission. And should I leave, the lecturer won't draw any attention to it. So definitely find out if your uni offers a support system such as this. Many unis will have a health and wellbeing team. And so the best thing to do is to contact them. And first and foremost, tell them that you have a medical condition so that they can let all the relevant members of staff know. And then instinctively, they will tell you about the support the uni offers to cater for your disability. I remember when I booked an appointment with a health and wellbeing officer, and my sole intention for that appointment was just to go in, declare my disability, to ensure that the uni are aware. And the woman I spoke to said, "Are you aware of a SORA?" And at the time, I had no idea what that was. But thankfully, she brought it up, and I've been benefiting from it ever since. Even before I started uni, I was doing some research on DSA. And from my research, I was under the impression that you can only apply for DSA if you have student finance. And because I don't receive student finance, I immediately discarded the DSA option, erased it from my mind, forgot about it. But then in the appointment I had, she asked me if I applied for DSA, and I said no. And then she said, "Well, why not?" And then I said, "Because you need student finance." And then she revealed you can still apply for DSA without having student finance. And then she then gave me a physical copy of the DSA form, told me to fill out the best I can. Any questions, I go straight to her. And then she was kind enough to send the form off through the post to help me on my behalf. So yeah, all the support I received, I owe it all to her and the other health and wellbeing officers that helped me. So the key takeaway messages from everything I've spoken about today is to absolutely speak to the health and wellbeing team at your uni, because there are support resources out there that you don't even know they exist. And the best way to find them out is just to have a conversation with just one individual from this team, and everything else will fall into place. And yeah, on that note, I hope that was useful. And thank you very much for the audience for taking the time to attend. And a big thank you to the CF Trust team for inviting me on. Thank you.
Thank you, Samir. A great outline of the DSA process, and lovely to hear that UCL are supporting you in your studies. Now over to Serena to talk about their experience and their daughter's experience while studying higher education.
So hi, yeah, thanks, Samir. That was really interesting. I just want to touch really briefly on the actual help that I've received from my daughter, Emily, from being put in touch with Nikki and Sangeeta. And I have to say, it's widely known, I am their biggest fans. So first of all, Nikki told me that effectively Emily was entitled to universal credit from the date she finished her A-levels until the date she started at university. And as you all know, that summer holiday is about 3 months long. And so she applied for universal credit and was granted it. So that really helped throughout the summer holidays. And without speaking to Nikki, I didn't even cross my mind that she could apply. So that was really good. Her universal credit did stop when she started uni, but she has had her work capability assessment only just before Christmas. So we're still waiting on that result. If it comes back as positive, her university credit will get backdated to September, which would be lovely. But a worst case scenario, if she doesn't continue with it because of it, she's not passed her work capability assessment, then she will apply again at the end of May when she finishes her first year at uni, and she's effectively got about 4 months off till second year. So hopefully she will get it to help throughout the summer, which is obviously fantastic. Nikki also told me about the special support element part of Emily's maintenance loan. And that's, if you remember, it's an element of the loan that she won't have to pay back. And for Emily, that is £1,954 for 1 year. So obviously that in itself has saved her nearly £6,000 over a 3-year course. So, you know, something my daughter was very excited about. Emily is having her disability support DSA assessment tomorrow, actually, even though she started in September. It's all obviously backdated because of COVID. But before she qualifies, but before the assessment, the things they've put in place at her university, very similar to what Samir said. The extra time in exams, the extra time to get coursework in, being able to take breaks in exams, but also because she has cystic fibrosis related diabetes, she's also allowed to take snacks and water into exams, which for her is massive. She didn't need a laptop, so that didn't apply to her at this time. But one other thing that the DSA did is they offered to link her up with other people, with other students on the course with cystic fibrosis. And what really pleased Emily was the fact that they knew about cross-infection, and whether she does link up virtually, obviously, with the other students or not, it's up to her. But for her, it just made her feel very loved and cared for by the university, that they mentioned, we do have other people with CF. We know you can't meet, but we can link you up virtually. That in itself meant an awful lot. So yeah, they're just in a real quick nutshell, the financial support and help that myself and Emily have got because of Nikki is just been fantastic. So I can just really recommend, please do get in touch with Nikki and Sangeeta. I can't even begin to tell you the amount of years Sangeeta has helped me with DLA and then PIP. Obviously, I think any of you probably have had dealings with help. So yeah, I can just really, from personal experience, please get in touch with them. This is a service, the Cystic Fibrosis Trust. This is from us to you. Please make use of it. It's really, really beneficial. And thank you so much.
Gosh, I don't know how to follow that. Thank you, bless your hearts, and thank you all for joining us. I hope that if nothing else, it's clear that students living with CF are not on their own on their journey through further and higher education. We are all here to support students to make the most out of their studies. I know it's 8 o'clock now, and there has been a couple of questions, so we'll provide responses to those where relevant post-meeting. The video for this event, for everyone who may want to watch it again or share it with their loved ones, it will be available on our YouTube channel next week. You can also find videos of all the CF Live events on our webpage, and updates on future CF Live events will also be posted here. Just 2 more things quickly to mention before we end. There's still time for everyone to take part in the James Lind Alliance Research Priorities Refresh Survey. Gosh, please fill it in and encourage your CF teams to do so too. A few minutes of your time could shape future CF research studies. The survey closed on the 20th of Feb and the link is in the chat. We are also in the middle of our 2nd annual February fundraising campaign. If you'd like to take part or find out more, you can see details on the screen now and in the chat. Thank you for listening, everyone. I wish you all the very best in your studies and have a very lovely evening.